Thank you very much. And I would like now to invite you to continue the conversation with each of our panelists. The idea would be you can freely join the conversation with any of them. And we've asked our panelists, if possible, to continue somehow the conversation with that topic. So division of work between humans and machines, ideas of task and practices, the trust in the AI system and the confidence in the AI systems and the relationship with clinicians, stakeholder relationship and relationship between doctor and patients, and the more organizational level, organizational design part. Ideally, we would like to have 10-15 minutes of conversation individually with our panelists, and then we will have the wrap up with Natalia later on. As I said, be creative. So now we will appropriate the space. So we have two, obviously, tables, but then we can move also our chairs.
Yes, so maybe for each of the tables, like very briefly, if you want to share something with the group.
So we're going to mention just a couple of points that was raised in our table. Basically, one of them was the importance of situating the AI in the organization. So the decision situation, we talked about how it's not being situated enough. And in fact, that we need to expand and zoom out to see that what's happening in that situation is not usually just an MD next to a computer, but it really involves an organization, an HMO sometimes, an insurance company, and those all play some sort of a role. And there's also we also discussed something called the expertise network. So it's also the professional, it's also the regulatory systems, and a need to look at a more distributive ecology. We also mentioned the fact that we need to look at both the deliberation process and not just the decision process that's happening in the organization itself. So we need to start that and not just the final decision, again, of an MD next to a computer. We discussed also the use of the word AI, sort of mentioned the famous sentence that machine learning is written in Python and AI is written in PowerPoint. And again, sort of discussed in the room, should we call this AI? Is this really learning in a sense, since we're not really talking about reinforcement learning, and mostly the models are already built from the data and are not being up to date or updated so much in some of these cases in healthcare. So we sort of challenged, is this learning and should we look more under the hood about the inherent process, technical process that's happening here? I'm probably missing or blanking on a lot of the points, but yeah.
Thank you, Lior. And debrief from Batya's table.
So maybe a few, so first, wait. So Tomislav, by the way, he's presenting to 6 o'clock today, but he has like a solution to or a possible insight into how do you turn leading indicators into interpretability. So switch from explainability to interpretability, and kind of looks at how you need to give people access to both the metadata and to the sort of, I mean, images, but
to both the outputs and the metadata, and together, instead of thinking just about explainability in terms of explaining internal features of the model, but really interpretability in a sense of relating the model to actual practice and the things that matter, and for instance with values, as we also mentioned here, and which also points to the very strong link between the question that we discussed with the organizational question, right? That was also posed in one of the other tables.
So if I understand correctly, this is a CTO division poster presentation in Hyatt Regency room, ballroom B.
Yes, drinks are included.
So I should turn it over, but I just want to say that Mark also had, that we talked about off-label uses and which are definitely proliferating, but the role of power in who gets to do this off-label use and the value of thinking about division of labor from socio-technical systems theory as a way of understanding how the organizational system will enable augmentation rather than automation.
Thank you.
Thank you. So we took a little bit of a different route and we realized we all have similar research interests. So we workshopped each other's papers a little bit. So we tried to be augmenting. So I'm going to pass it on to the next table.
Okay, that was quick. So we'll summarize what happened here. A lot of moving parts, but first we discussed whether we could use, the data following basically a database form of organizing, or using the data flows to understand organizational forms. And that led us to look at some examples from street level workers and how basically new data or new knowledge objects make possible new forms of organizing, or reinforce or enable new forms of organizing. Then we went on to this idea that social science is just a retelling of all stories, but using maybe slight different variations. And so we discussed the work of Steve Barley, of course, and whether it was still relevant, or in what way would we tell it differently now that we have access to so much more data and processes than when he did his field work. So that seemed promising to build on the shoulders of giants, but still tell a slightly different story. And finally, we discussed how AI interacted with knowledge work, ranging from kind of how we do treatments and basically seeing a lot of the medical work from a knowledge angle, or looking at communities of where patients and doctors come together to support each other or to share knowledge about their diseases. I don't think we reached any conclusions, so I'll let Stella do that.
Yeah.
Okay, I don't think I can reach the general conclusions, but I thought there were, and I'm mindful of the time, so I'm not going to repeat everything, but just two important points that came up that hadn't really been addressed earlier, which I think are worth mentioning. One, the difficulty to develop metrics to quantify to what extent, even if we assume that the AI is accepted and it becomes used, how can we actually prove that it adds value, and in what ways? We discussed that people find it very difficult to define this value, and I think Natalia's case with the radiologists shows that it's actually much more complicated. It's not a matter of saving time necessarily. So that aspect, and then the other aspect, which I think is quite clear, is we've been spending the last 2 hours talking about AI, and even not necessarily accepting that we are there yet, and that the system works, but that all those algorithms will learn, etc. But we haven't really talked about the data and the quality of the data, and that's a huge issue about all kinds of organizations, but that includes, of course, healthcare as well. Obviously, I guess it depends on the area, but in certain categories of AI, there's lots of data that is missing. Data is not captured sufficiently because people are in a rush and they do not have time to datafy, or maybe they're not willing, they always prioritize it less. The quality of the data as well, the technical challenges of capturing all this data from the different data dumps, and as actually Summer mentioned earlier in his tale, right? This is an important aspect that we need to take into consideration, and which is definitely affecting the efficacy of the tools as much as the acceptance as well. Because if people cannot trust that the data that is inserted into the system is correct, they will definitely not trust the insights. So yeah, thank you.
Thank you, everybody. I was planning a few remarks. I think it's actually Stella's last comment was what I wanted to bring up, that we seem to have an assumption that AI is good and humans are good, hence collaboration between AI and humans is good. But it's often then in what I've seen that AI is not as good as it appears, at least in the publications, or humans are not necessarily as good as experts. And then there is this kind of question of relative expertise quality. And I actually think it goes back to what the first table discussed, which is then the real question is how do you define quality and what quality matters? Because it's one thing to define the quality of diagnosis, like accuracy is usually all that's used, versus quality of care, quality of healthcare outcomes, quality of the whole healthcare system. And I think I interpret it, Lior, your point to be we need to broaden the context. So I think that's, and my last point I was going to make, and I was waiting for somebody to bring in money, right? We're in a business school. So I feel like not a single one of us commented about money, even in terms of adoption incentives. And I do think that many of us who believe augmentation and collaboration are important know by now that it takes time to reconcile divergent opinions. So that means somebody has to pay for that extra time. And that brings in the question of the business case. Back to Becky, what you were talking about strategy, what's the business case if it's going to be taking more time? It has to be some type of time saving somewhere else. And my last thought, I really learned a lot from the presentations that Angela and Julia made. By the way, they have to leave to other workshops about like what's special about healthcare. And it occurred to me, and I don't know if people agree, but like healthcare is a setting where you as a patient never want anybody to save money on you, right? Except unless you pay for it yourself. But the system as overall is all about like efficiency, so not to a large degree. So there is an inherent conflict, which is sometimes the case in other settings. I'm not saying it's unique, but that I kind of keep thinking like, I want my doctor to have 3 tools, consider all of them, make the best diagnosis given their experts, and maybe even ask another doctor. But right, there is scarcity of resources and money. And so that seems to be one of the aspects that we might want to highlight about healthcare. Like I like what you said, like individual patient versus averages. This also applies to finance issues. And the last point I was going to make when I was hearing you, Becky, is about like strategy. I thought Karim Khani and sorry, your other colleague, Marco, right, essentially, they wrote a book about AI strategy. And I was thinking, what did they not cover? And because I teach based on their book and cases, they seem to be all about data. And we here seem to be a lot more, like the whole AI strategy is about data, pipelines of data, feeding. And I guess what we can add even on the strategy angle is beyond data. Also, I'm a big fan of it's about data, but still I think there's other issues. So maybe if you go towards strategy route, there's other issues of work designs that Becky highlighted and it's her work shows is kind of adding to the talk mostly about data as part of strategy for AI. And sorry, we kept you a bit late and thank you so much. It's a great start for my academy. So thank you.